Hey folks, my name is Parky Lau, and I've been a researcher, educator, and practitioner of behavioral sleep medicine for a better part of a decade. I earned my PhD in clinical psychology in 2024 and then completed a specialized postdoctoral fellowship at Stanford's Sleep Health and Insomnia program, so ostensibly I know at least a little bit about sleep to tell you about that today. So, in my doctoral studies, we commonly ran these clinical trials providing cognitive behavioral therapy, which is the frontline gold standard treatment for chronic insomnia, and found that about 80% of folks with insomnia went from being a poor sleeper to a good sleeper, so reducing their insomnia symptoms by about 50% or more within just 4 sessions of treatments. And certainly, even beyond that, many of the other people who weren't quote unquote remitted still saw significant improvements in their sleep problems and insomnia symptoms. So in this video, I'm going to talk about some of the strategies that I use with patients to help them see the substantial night and day improvement, literally and figuratively, without the use of medication. And the great thing about cognitive behavioral therapy for insomnia, or CBTI, is that it's just as efficacious as medication in the short term, but it's much, much more durable in the long term. So some studies have found that even after 10 years after treatment, patients still remain good sleepers. So the first strategy that we'll talk about is time in bed restriction therapy. So for those of you who know a little bit about treatments of insomnia, you might have heard it before as sleep restriction therapy, but I prefer time in bed restriction therapy as a term for 2 reasons. So the first reason is that it's a more accurate indicator what the treatment actually is. So in sleep restriction therapy, the idea, as it sounds like, is that we're trying to reduce how much you're sleeping, which is actually not true of time in bed restriction, which is time in bed restriction is actually reducing how much time a person is spending in bed. So they're not spending less time sleeping, they're just spending more of that time in bed with consolidated sleep. And not only is sleep restriction therapy not a very accurate indicator of what the treatment actually is, the second part is that it, of course, unsurprisingly, increases anxiety in our patients. Like when we think about sleep restriction therapy, this is gonna increase anxiety about like, oh my gosh, I already only sleep like 4 or 5 or whatever hours. How can I reduce that even more? That sort of spike in anxiety isn't going to be very good for treatment outcomes because the person's going to be anxious. They're going to be worried about doing the recommendation. So they're either not going to do it or they're going to drop out. And it's just kind of a horrible experience overall. So time in bed restriction is the term that I use because it's more accurate and it scares the patient a lot less. So when it comes to time and bed restriction, I usually like to explain it through a little metaphor. It's kind of silly metaphor, but essentially, let's say you have 6 inches worth of pizza dough, but you have a much larger 9-inch pan. What would happen if you were to stretch that 6-inch worth of pizza dough into the much larger pan? And your answer might be, well, of course, like it would be kind of really thin. It might get burned. There's going to be holes in the middle of it. And the same thing can happen with our sleep. Let's say right now we're sleeping 6 hours, but we're spending 8, 9, 10 hours in bed. Our sleep is going to experience the same phenomenon as the pizza dough. It's going to be very light. There's going to be a lot of awakenings in the middle. It's just not a very good situation overall. So fundamentally, time in bed restriction works by reducing how much time we're spending in bed to a point comparable to how much sleep we're producing right now. So let's say you're sleeping 7 hours, but you're spending 10 or 11 hours in bed. The idea behind time in bed restriction would be to bring that 10, 11 hours time in bed into about how much we're sleeping plus 30 minutes. So we give ourselves a little leeway. So in this case, it'd be 7.5 hours. And in terms of how you might choose when I should go to bed and when I should wake up, you can decide that based off your schedule and what feels right for you. So if you feel like, okay, well, I need to wake up, every day around 7 a.m., you make your way 7.5 hours back, and your earliest bedtime will be 11:30, and you'll wake up at 7. So a couple issues that people sometimes take their time in bed restriction. Number one is, well, what if I don't sleep at all? I feel like I got 0 hours worth of sleep, or I only got 2 or 3 hours. Are you telling me to restrict myself to 2.5 or 3.5 hours? And the answer to that is no. Usually we have a baseline minimum. So it's usually about 6 hours, such that if you are finding you're sleeping way less than 6 hours, then you can make the minimum 6 hours. So you can say, okay, well, I only sleep 2, but I'm going to put 6 on the clock. So let's say it's 12 to 6 or 1 to 7, whatever feels right for you. And a second common concern that patients often have is, well, what if I, have to wake up at 7, but I'm not sleepy at 12, I'm not sleepy at 1, and all of a sudden I'm sleeping at 4 a.m., but I have to wake up at 7. Like, what do I do then? But this idea gets into the idea of what CBTI is all about, which is that's never focused on the current night and how do I make sure the current night is good. How do I make sure that the next night is actually better so that we can get out of the insomnia trap and get back on track. And the way that this works is through something called the principles of sleep regulation, where essentially sleep kind of comes from two main factors. One is our sleep drive, which is our appetite for sleep. And just aligned with that analogy of appetite, the longer that we are, not eating, for example, the hungrier we get, the longer that we are awake and active throughout the day, the more pressure or sleep drive or sleep appetite that we build up by the end of the night. So let's play this out. Let's say you were supposed to go to bed at 12, you wake up at 7, but you're not sleepy at 12, so you don't go to bed, and you actually fall asleep around, 3 or 4 a.m., and you still have to wake up at 7. So that night's gonna be pretty tough. But what's gonna happen the next night is that you're gonna have extra appetite for sleep. So by the time you get to 12 again, on the subsequent night, you're gonna actually have a lot of extra hunger for sleep. So in this case, we're almost sacrificing a few chess pieces to win the game of the next night. By the way, if you're interested in learning more about cognitive behavioral therapy or CBTI and its main principles, I've actually written a book. It's called The Insomnia Paradox, which is a pretty clear and concise way of understanding how we can apply the CBTI principles into our lives. So the link is going to be in the description if you want to check it out. Okay, so that was time in bed restriction. The second strategy that I often use with patients is something called stimulus control. And the idea behind stimulus control comes from the idea and the story of Pavlov's dog. So you may have heard of this experiment before, but essentially Pavlov's dog was an experiment by Ivan Pavlov where he essentially was studying the digestive habits of dogs, and he would ring a little bell every time the dogs were about to be fed. So when he was going to give them that big juicy steak, he would ring a little bell. And over time, what he noticed was that even when there was no steak around, there was no yummy food around, he would ring the bell, the dog would begin to salivate anyway. And what he reasoned was kind of led to the idea, the foundations of classical conditioning, that the dog had begun to associate the ringing of the bell with food, such that even when there was no food around, the dogs kind of thought, oh, it's time for food, and they would begin to salivate. And the same phenomenon can happen in the context of chronic insomnia. So when a person spends so much of their time frustrated, worrying, doing wakeful activities in bed, over time the bed becomes associated with sort of that same wakefulness and that same frustration. And that's why you will hear some patients or some people have the experience where they're going to bed, they're feeling kind of sleepy, but the moment their head hits the pillow, it's like a light bulb went in their heads and they were feeling wide awake. And under the principles of classical conditioning and this learned association, our strategy of stimulus control is meant to break the association between bed and wake and restore the association between bed and sleep. So if I were to ask you the question, like if I was trying to make sure that you built this relationship between the bed and sleep, what would you recommend? You would probably have some pretty decent ideas of like, well, I should probably not be playing video games or worrying or tossing and turning in bed. I would probably want to make sure that the bed is only for sleep. And I would want to make sure that even if my earliest bedtime by time in bed restriction was 12 a.m., I shouldn't go to bed at 12 if I'm not sleepy, and I should get out of bed if I notice that my mind is starting to awake, and I should also probably not use the bed again for anything wakeful or do my homework on my bed, for example. Also, I've created a free insomnia self-help guide. If you're interested, feel free to just put insomnia in the comment section below, and I'm happy to give you that link free of charge. Thanks. And if you said that, you would be 100% right, where essentially we don't go to bed until it's at least our earliest bedtime. So in the context of someone sleeping 7 hours, they have a 7.5 hour time in bed. Let's say it's 11:30 to 7. They won't go to bed until earliest 11:30 if they're sleepy. And if they're not sleepy, they keep on doing something else that's enjoyable and relaxing until whether it's 12 or 12:30 and only go to bed when they're actually sleepy. And then, sort of key point, if they notice that when their head hits the pillow, they're feeling more and more awake, to get out of bed, do something enjoyable, do something relaxing, watch TV if you want, listen to music if you want, and only again, go back to bed when you're sleepy while still waking up after 7 a.m. wake time. So time in bed restriction and stimulus control represent kind of the two most powerful behavioral strategies that we can leverage to be able to get out of the insomnia trap. And along that, there are some other strategies that are helpful to reduce our levels of arousal and our anxiety before we get to bed. So, one of the strategies that's important is having a proper wind down time. So, oftentimes, people who are very busy professionals or they have a very active social life, they're gonna go to parties and come back and immediately try to sleep. Or somebody is kind of working on their emails and doing projects way into the night and then immediately trying to sleep after that. And usually, the person's brain or their sort of activity, physiological arousal is gonna be quite high. And that's gonna be a direct opponent to our ability to sleep well. So one thing that you can do is just set a nice proper wind down time. So maybe 30 minutes or an hour before bed, you want to make sure that the lights are dim, you are generally in a quiet state of mind, that you're doing something that is truly enjoyable and relaxing for you. And this can be kind of a choose your own adventure. It could be listening to music, having a nice cup of chamomile tea, watching, a rerun of your favorite show, whatever it is that's relaxing personally to you can be the activity that you choose. And when you're engaging in this wind down period, don't see it as like a forced attempt to try and get yourself to be sleepy, but treat it as a time just for yourself. And when sleep is ready to take you away, that's when you can take that cue to go to bed. Another strategy that you can use to generally reduce physiological arousal are relaxation exercises. So when it comes to relaxation exercises, one of the important things is that you try not to do it, again, for that intent or sake of falling asleep. So we don't want to engage in something called sleep effort, where we're trying to intentionally put ourselves in a position to fall asleep. We want to let sleep come take us. So one thing that can be helpful would be to practice the relaxation exercises somewhere outside of the sleep period. So it could be kind of early in the morning, in the afternoon, early evening, whatever that is for you, that you can kind of keep pretty consistent and regular. And you can basically use anything. You can use your Calm app. You can find it on YouTube. I will throw a couple links of my own meditation tapes down below if you'd like to check those out. And another way to reduce arousal, especially the ones that are less physiological, like in your body, but more like just an active mind, one strategy is something called the worry time. And worry time, as the name suggests, is that we're essentially moving the worries that are happening at night and bringing it a little bit closer to sort of that evening period where you essentially can just take out a piece of paper, take out a journal, and write down the things that you think might sort of bother you at night. So if they're more problem-based worries like, oh, I have to set an appointment for tomorrow, then you can kind of write down the solution and say, oh, I'm going to call in the morning. Or if it's more of like a processy, just something about the future that's kind of nebulous and you're uncertain about it, you can just write your thoughts and feelings down, give that space to kind of allow yourself to worry. Now, not all worries can be captured with worry time. And the reason for that is because some of our worries are going to be very sleep specific. Like, oh my gosh, if I don't sleep well tonight, tomorrow is going to be a disaster. Or, it's going to feel so horrible for me if I were awake all night. It's just such a distressing feeling. I hate it. And those types of scary sleep related anxious thoughts are going to be barriers to treatment because if you're really anxious about your sleep, you're not going to want to try anything new. And in and of itself, anxious sleep related thoughts move us further from the goal of being able to sleep. And since this isn't a therapy session, I won't be engaging some sort of cognitive therapy with you. But one thing that I think can be really helpful for folks is to find a couple coping statements that really help reduce their anxiety that gets to the core of their fears. So a couple examples for you. One would be to recognize that what you're doing right now is for the next night. So I'm not trying to save the current night. I'm trying to fall asleep earlier today by spending less time in bed, by engaging in stimulus control. I'm actually setting myself up for success tomorrow. Another strategy that can be helpful, especially for the people who worry about the impact that their sleep deficit has on their performance, is to identify the resilience that has occurred in the past. So one sort of common theme that I've noticed with my patients is that they're often very catastrophic about the impact their sleep has on their performance. At the same time, these were people who were generally quite successful. Yes, it was much harder, but they were very successful. Like they did well in their jobs, they were able to take care of their kids, they were able to have successful careers and families. Again, everything being a little bit harder than usual than if they did have some good sleep, but that they were ultimately resilient, and they're resilient in this case for the sake of improving their sleep by following these recommendations. So some statements that can be helpful is to know that one, you're working towards the next night, the subsequent nights, focusing on long-term sleep health. Number two, that you are resilient in many different ways and you can identify the things that you have been resilient to or the successes that you've had in spite of your sleep problem. And for the people that are a little bit worried about the impact that their insomnia has on their health, one thing that can be helpful to note is that you are looking for help, whether it's you're watching this video, you're looking for CBTI treatment elsewhere, you're, reading a book, whatever you're doing, you are trying your best to make sure that the long-term effects of sleep problems aren't going to be there forever because you are, you're here, you're trying to learn and you're trying to apply these skills into your life. So to recap, the strategies that you've learned today, number one, you want to build up your appetite for sleep, set that strong circadian rhythm by going to bed and waking up around the same time and spending a commensurate amount of time in bed relative to how much sleep that you're producing. So about your total sleep time, give or take 30 minutes. You're also going to practice stimulus control by not going to bed until you're actually feeling sleepy and it's after your earliest bedtime, dictated by the time in bed restriction, and also get out of bed if sleep is not coming, doing something that you enjoy, treat it as, it's a success for me to just get out of bed and do something. This is not meant to force me to fall back asleep or make me fall back asleep. We don't know that's going to happen. Again, we're focused on the next night. We're not trying to save the current night. And for the rest of the strategies like worry time, relaxation exercises, these kind of coping statements, you can kind of pick and choose the ones that actually feel right for you. So as you were kind of listening to me, you can say, okay, well, I actually do like the worry time a lot, or, it'd be really cool to have more of a intentional wind down time. So pick something that actually fits for your life. You don't have to take the whole kitchen sink and throw it out the wall to see what actually works. Pick the ones that actually feel right for you. Anyway, that's all for this video. Thanks a lot for watching, and I hope you found it a little bit useful to learn about sort of behavioral sleep medicine and how we use CBTI strategies for chronic sleep disturbances. If you're interested in learning a little bit more, diving a bit deeper into how do we handle anxious thoughts at night, I'll throw up a video over here, as well as a video over here about how we can kind of get rid of that sort of grogginess or inertia in the morning. Thanks for watching again. Take care.